COVID-19 cases are surging from coast to coast. Some states are beginning to lock down yet again. Nevada isn't there yet, but Governor Steve Sisolak made an urgent plea on Tuesday for Nevadans to stay home for 2 weeks.
If you don't have to go out, don't go out. Reduce your time in public to what is necessary and limit any and all exposures to those outside of your household.
As COVID-19 cases and hospitalizations shoot up in both Clark and Washoe counties, and health experts and the governor urge people to stay home, there's a new tool showing COVID risk in group settings in every county across America. That risk factor updates daily. Here's Georgia Tech research scientist Dr. Stephen Beckett, a part of the team that created the dashboard.
Primarily, this is thinking about the risk that one or more people at an event of a certain size might be infected with COVID-19.
Looking at Nevada on Thursday, we'll start with an event of 10 people. In Clark County, the dashboard shows a 21% probability that at least one person in the group is infected with COVID-19. In Washoe County, that number is at 34%. An event of 25 people, a 45% chance in Clark County, a 64% chance in Washoe County. 100 people, a 91% chance in Clark County, a 98% chance in Washoe County.
We really want this tool to kind of help inform people about what the risk might be.
UNLV Assistant Professor Brian Labus has a background in infectious disease epidemiology, including outbreak investigations and disease surveillance. He isn't involved with the team that created the dashboard, but he says the tool illustrates the reality of how quickly the virus can spread.
It really helps people, I think, understand that those larger gatherings do carry a real risk of having at least one infected person there, and that's all that it takes to spread disease.
We have a link to the interactive dashboard on our website, news3lv.com.
We brought you their story back in September. An ER nurse who died days after he contracted the virus, his wife shocked, telling us he was extremely fit with no underlying health conditions. Now she's using her experience to remind Valley residents that this virus hits fast and it hits hard.
If I could tell anybody anything, like, don't take it lightly.
On Thursday, health officials reported more than 1,400 new COVID-19 cases and 3 new deaths. These are numbers that rival the beginning and the worst days of the pandemic.
The alarm right now is because the infections have gone up, the hospitalizations have gone up.
This week, Governor Sisolak addressed Nevadans, announcing Stay at Home 2.0, asking people not to go out unless absolutely necessary.
For the next 2 weeks, we must mimic our stay-at-home behaviors from this past spring.
However, polls posted on our social media pages show there are still people who aren't honoring the governor's request.
Throwing caution to the wind puts you, yourself, your mom, your daughter, your son, your husband, your wife at risk. And is it really worth it?
For those who might be experiencing pandemic fatigue or have simply forgotten what a toll this virus can take, Greg Peistrup wants you to remember her husband, 53-year-old Greg Peistrup, a nurse who worked on the front lines of the ER throughout the entire pandemic. It wasn't until 7 months in that he contracted the virus, and with no underlying health conditions and in good shape, he died just 12 days after testing positive.
It affected older people, it affected people with comorbidities, and when we take a healthy individual who had no comorbidities and watch that rapid decline, it really hit home just how serious this virus is.
And so far, there's been more than 114,000 confirmed cases in our state. Of those, more than 1,800 have died, and more than 2,500 are on record having recovered from the virus.
You said you don't believe shutting down the nation is the right path, but if there is a spike, would that change your position?
Well, obviously you always need to keep all of the potential actions and responses on the table. I would like to, and many of my colleagues would like to not see us have to resort to a lockdown. The country has COVID-19 fatigue. The consequences of lockdown from an economic as well as a literally morale standpoint are very, very important. However, we must realize that you can get a lot done without necessarily locking down. If you adhere to the fundamental principles that many of us, myself included, have been talking about for quite a while now, the uniform wearing of masks, the physical distancing, the avoiding congregate settings and crowds, the doing things outdoors preferentially over indoors, and washing of hands, If you do those things uniformly throughout the country, not in a scattered way, some do it, others don't, but as a nation, buckle down and respond, we can turn this around. And the other important thing that I think we should get people to understand, that help is on the way. We have a vaccine that recently has been shown to be highly effective. It's likely another one will be coming soon with similar results. So that should be an incentive for us to buckle down and continue to double down on the public health measures until a vaccine comes and helps alleviate this by providing protection gradually over a period of time. The first vaccine doses will be available in high priority individuals in December. And then as we go into January, February, March, April, May, more and more people will be able to get vaccinated. So the message is hang on and keep doing the public health measures. Don't give up, because help is really on the way.